The CDC created something called the Social Vulnerability Index, and it was created to help public health officials and emergency response planners identify and map the communities that will most likely need support before, during, and after hazardous events such as the COVID-19 pandemic. The SVI ranks every U.S. census tract on 15 social factors. That includes unemployment, minority status, disability, and it further groups them into 4 related themes. You can see socioeconomics, household composition, minority status and language, and housing and transportation. What we're looking at right here is an example of a hospital network and patient population in Detroit, Michigan. And so we can see where the hospitals are located. We can see where the patients are located, and they're grouped and clustered, and we could actually see them and take a look at demographic factors and statistics. And it's overlaid with social factors. And in this case, it's people with no vehicle. So the way that we could use this is we could actually maybe apply some filters or make some selections. We want to identify people that live far from hospitals or don't have transportation. We want to arrange for transportation for them. And so we can use selection tools to then take a look at people that live in the dark purple areas and people that may be far from the hospitals, and come up with a list of those patients and arrange transportation for them. And these indexes can be used in a variety of ways. They can be used to identify where homeless shelters should be placed, decide how to best deploy emergency personnel, and ultimately identify patients in locations at greatest risk to COVID-19. So some examples would be housing density is a problem, and that is where a lot of spread happens. So we could take a look at where is crowding most prominent, where are the most multi-unit structures that we see. Of course, we could identify where are the elderly patient populations, or we could take a look at where are people unemployed, or where are they living within poverty. And we can ultimately combine this information with filtering and reporting and identify those at greatest risk and communicate this information to community outreach centers or hospitals to improve their patient outcomes.